All right, so this is part 2 for chapter 12, and I got myself together, and I'm not sure what my kids are writing on the board here. I just wanted to make sure it was appropriate. So EKG, that was the word or abbreviation, I guess, that I couldn't come up with in the first video. So an EKG is actually used. MAs are taught how to do EKGs. So a lot of our MAs inside of the doctor's offices, especially if they're a cardiac or a cardiologist, learn how to do the EKGs. But an EKG is when you connect all of the little connections to your chest, on your back, and it reads the arrhythmias and the rhythm of your heart and your heart rate and all of that stuff. So it's an EKG. Okay, I'm sorry for the brain lapse there. I guess it's one of those days. So part 2, blood clots. So a thrombus are blood clots that are transported in the blood. Pulmonary embolism, known as PE, is a piece of clot which breaks off from the main clot and travels to the lung, blocking the pulmonary artery. Deep vein thrombosis, known as a DVT. This is a venous thrombi which forms in areas of low velocity blood flow, such as the lower extremities. And surgical or other vein injuries or large venous sinuses. So a lot of times anyone who has had any type of surgery and has been in the hospital, they will put compression leggings on your legs. That is to help prevent the blood clots or the DVTs from forming in your lower extremities. Can you hand me the charger, please? Laptop's dying. So anticoagulants. So anticoagulants are used to prevent clot formation by inhibiting the clotting factors. Antiplatelets reduce the risk of clot formation by inhibiting platelet aggregation, which means the platelets sticking together and forming the clot. So there's a difference between anticoagulation, which the anticoagulation drugs are used to inhibit your clotting factors. The antiplatelets are inhibiting the ability for the platelets to aggregate or bind or stick together, which causes which actually forms the clot. Anticoagulant agents, so direct thrombin inhibitors would be dabigatran, known as Pradaxa. This drug works by directly binding thrombin, which can inhibit the circulating thrombin as well as thrombin that are bound together. There's a lot of side effects. It is used in the prevention and treatment of DVTs, also pulmonary embolisms, and it is used to help prevent stroke in patients that have atrial fibrillation. Heparins. So heparin is only available in an injectable form. You will not find an oral version or any other dosage route for heparin. It is only available in heparin. Heparin is actually dosed in international units or IUs, and that is something that cannot be converted to milligrams, grams, or anything like that. It's its own entity. It works by inhibiting the thrombin formation, which reduces the ability of the blood clot to form and prevents the formation of any new clots from starting as well. The antidote for heparin. So if you have an heparin overdose, which hopefully does not happen, I have seen it happen, and it is a very traumatic experience. When I was working in the hospital, we had a code called in the emergency room. A nurse was supposed to give a 5,000 unit international unit bolus, and instead she hung a 25,000 unit IV bag. The patient overdosed on heparin. Their blood had no clotting factors at all. He went into cardiac arrest, and as we were doing CPR, he was bleeding from every opening in his body. His eyes, his ears, his mouth, his nose, And as we were doing chest compressions, the blood was kind of squirting all over the room. So it was a pretty traumatic experience. The pharmacy, so I worked the code in the ER that day, and my counterparts were down in the ER in the pharmacy preparing protamine, which is the antidote for heparin. And they were preparing the protamine bags and flying them up to the emergency room, and we kept pumping the protamine into the patient very quickly, but unfortunately it was not enough to reverse the heparin, and the patient did pass away. So it was it's a pretty traumatic experience. It's a code that I will surely never forget, and it was a medication error on the nurse's part. Low molecular weight heparin, so you have enoxaparin, which is Lovenox. This is probably the most common low molecular weight heparin that you will dispense, either in a retail or a hospital setting. So it is used to prevent thrombosis after surgeries. It is used for the treatment of DVTs, and it can also be used in the treatment of pulmonary embolisms. Factor XA inhibitors, these work by blocking the activity of factor XA, which helps prevent the clots from developing or getting worse. So Xarelto, I'm sure you've seen the commercials for that. Eliquis is another one. This is how they work. Vitamin K antagonists, so warfarin, which is the generic name for Coumadin. It inhibits the vitamin K dependent clotting factors. So remember, when we were looking at our vitamins, vitamin K is actually the antidote to Coumadin. So if you have too much Coumadin or warfarin in your system, they're going to give you the antidote of vitamin K, because vitamin K actually is necessary for our bodies, and that's what helps produce our clotting factors. Again, the antidote for heparin, or for warfarin, is vitamin K, and they can do that through the hanging of an IV bag that is vitamin K specific, or they can just do a fresh whole blood transfusion on the patient as well. Warfarin or Coumadin actually interacts with a ton of drugs. You can see a very small list of that on slide 39, but it's really important that we have the patient's full profile, especially if they're on any type of anticoagulants, especially Coumadin or warfarin, because it does have a lot of drug-drug interactions. General antiplatelet drugs, aspirin. Aspirin works really well. And Plavix. Plavix has been around for a long time as well, and these are used to prevent the platelets from sticking together and forming the clot. Stroke. So the stroke is a result of an event that interrupts the oxygen supply to a localized area of the brain. Transient ischemic attack, known as a TIA, is temporary neurologic changes during a brief period of time. Symptoms of a stroke: sudden numbness or weakness in the face, arm, or leg, sudden confusion, difficulty speaking or understanding their speech, sudden trouble seeing in one or both eyes, sudden dizziness, loss of balance or coordination, and sudden severe headache with no known cause. So they have the different parameters. If you have someone that is suspected of having a stroke or suffering from a stroke, obviously you should be calling 911 right away, because there is a very small window of time, 45 minutes to an hour, to get medications on board to help lessen the amount of damage that's caused from the stroke. So paying attention to any droopiness in the face, in the mouth, one side drooping, in the eyes versus the other, and then have them place their arms straight out. If they're doing this and they have a droop in one arm or the other, that's another sign indicative of a stroke. So types of stroke: ischemic is an obstruction to the blood flow in a cerebral blood vessel. Hemorrhagic stroke is a rupture, the primary rupture of a cerebral blood vessel. So you have one that is blocking. The hemorrhagic is actually the rupture of a blood vessel within the brain. Excuse me. Risk factors. So, modifiable: cigarette smoking, coronary artery disease, diabetes, excessive alcohol intake, hyperlipidemia, which is increased cholesterol levels, hypertension, high blood pressure, obesity. So these are things that we can change and modify through diet and exercise, changing our lifestyle, stopping certain things of habits that we're doing. The other thing is with the hyperlipidemia and the hypertension is taking medication and making sure that those things are controlled. Non-modifiable: age, gender, genetic predisposition. A prior stroke puts you at a higher risk, and some races or ethnicities have a higher risk of stroke than others. Cholesterol abnormalities. So hypercholesteremia, that's a mouthful, is an excessive amount of cholesterol in the blood. Hyperlipidemia is a condition in which the levels of one or more of the lipoproteins are elevated. Dyslipidemia is a condition where the levels of lipoproteins are elevated and or the levels of the other form of lipoproteins are actually decreased. Causes of dyslipidemia: it's an inherited thing, and then someone that has a diet high in saturated fat. High density lipoproteins, known as HDL. These transport cholesterol back to the liver for excretion. It's known as the good cholesterol. Your low density lipoproteins, known as the LDL, that is considered the bad cholesterol, and that actually brings the cholesterol to your body cells, which then is at risk for being deposited into your arteries. Your triglycerides are neutral fats that are made from carbohydrates for storage in the fat cells. Treatments for dyslipidemia: HMG, CoA reductase inhibitors. These are your statins. Okay, so again, the suffix. So atorvastatin, fluvastatin, pravastatin, simvastatin. The statin should be your indicator here. Okay, they work well. They inhibit the enzyme that catalyzes the rate-limiting step of cholesterol biosynthesis. You may want to pay attention to that. That might be a question on your final exam. Fibric acid derivatives, so fenofibrate, gemfibrozil, which is the generic for Lopid. These increase the excretion of cholesterol in bile, so it helps when your cholesterol is being delivered back to the liver. It is helping the excretion from the liver into bile, which eventually will become waste. So we're ridding the excess cholesterol from our body. Omega-3 fatty acids. So these are derived from fish. Another thing is we call them as fish oil. This is used in adjunct to diet to help lower triglycerides. You can have usually doctors will tell patients to take fish oil, and in addition to any any cholesterol lowering medications. Varicose veins. These are veins which the valves no longer function properly, allowing the blood to travel back towards the extremities. Complications of varicose veins. Typically they don't cause complications, but if you have a lot or excessive, it can cause an inability to walk or stand. You can end up getting skin ulcers, and if you have a minor trauma in that area, you find that you have excessive bleeding. Treatment of varicose veins: support hose, sclerotherapy. Okay, there are medications that are used to help force the vein closed, which will force the blood then to travel to the healthier veins and not congregate there. Complementary and alternative therapies. So plant sterol esters. So these are found to significantly lower LDL, which is the bad cholesterol. They are recommended to be used in conjunction to diet and drug therapy for hyperlipidemia. You can find certain amounts of it in margarine or juice. Red yeast rice is a fermented rice product that is used in recipes. It's also used in supplementation So supplements to help lower cholesterol and improve overall cardiovascular health. Tocopherol, alpha tocopherol or vitamin E is an antioxidant that's used for cardiovascular disease. It's also used for cancers, diabetic neuropathy, but the effectiveness has not been fully proven. Garlic has been shown to have possible effectiveness in treating atherosclerosis, which is the deposit of cholesterol inside the arteries, hypertension, some cancers, and skin fungal infections. The garlic supplement must contain allicin, which is the active ingredient in garlic. It does interact with warfarin and any other protease inhibitors. So it's important that if your patients are using any type of over-the-counter dietary supplement to support either cholesterol levels, blood pressure, or overall heart health, that we have a full picture of that so we can make sure that any prescription medications they may be prescribed are not going to interact with those or vice versa. And that completes chapter 12.